Good morning and welcome to our webinar. My name is Sue Hegedal and I'm the Executive Director of the Older Adult Centres Association of Ontario, the OACAO. And we've come together today for a presentation titled Managing Your Digestive Health, presented by the Canadian Digestive Health Foundation and hosted in partnership with Oasis Benefit Plans for Not-for-Profits. In this webinar, we will learn about digestive conditions and gut health to help us manage these digestive conditions, of which many do not currently have a cure. I would like to thank Brent Voisey, Director of Sales and Marketing from Oasis, for supporting this webinar, and I want to acknowledge the excellent work that the whole Oasis team does supporting OACAO members and not-for-profit organizations across Ontario and Canada to provide affordable and accessible employee benefits for staff and retirees. Please feel welcome to reach out to myself or Brent should you have any questions about Oasis. I would also like to acknowledge and thank Lena Zita, the OACAO Development and Marketing Coordinator, for her admin and tech support on our webinar today. Before we begin, I would like to start by acknowledging the Indigenous peoples of all of the lands that we are working and participating from today across Ontario. While we are meeting virtually, I acknowledge the importance of the lands which each of us call home. We do this to reaffirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nation people that call this land home. We are grateful to have the opportunity to work and live on this land, and by doing so, give our respect to its first inhabitants. We're using the Zoom webinar platform today, which means you've arrived in listen and observe mode only, with no cameras and your mics are off. We do encourage you to use our chat box or Q&A function to jot down your questions or comments, and we will respond to these at the end of the session. If you require any technical assistance, please use the chat box to send a direct message to Lena if possible. We have enabled the live transcript feature today, which you can see at the bottom of your screens to increase accessibility, but you can adjust that setting on your own system by clicking on the icon yourself. As noted earlier, we are recording this session today and will make the recording available to all registrants after the webinar. We'll also send out a link to a short survey that we kindly ask you to take a few minutes to complete. I would now like to introduce our presenter today. Kelsey Cheyne is the Executive Director of Canadian Digestive Health Foundation, and Kelsey will tell you a bit more about herself once she begins. I'm going to hand it over to you, Kelsey.
Thank you. So hi, everyone. Just wanted to first say thank you to Oasis and the OACAO for having me here today. I am thrilled to be speaking with you guys virtually about digestive health, something that is not often spoken about, but needed. Today, I will be walking you through who the Canadian Digestive Health Foundation is. I will be speaking with you about the top digestive conditions that affect millions of Canadians, but are often gone unnoticed. So just a little bit about me. I am the Executive Director at CDHF. I started about 7 years ago as a communications coordinator and sort of made my way up to Executive Director. I just wanted to preface this presentation by saying that I am not a healthcare professional. So if you do have any questions specific to the diseases that I cannot answer, I'm happy to take that back to our team. We work very closely with a number of healthcare professionals. But the idea is that if there is enough interest in this sort of first kickoff webinar, the next webinar that we could have with you guys would be with a healthcare professional. So as I mentioned, I do work for Canadian Digestive Health Foundation. So if you haven't heard of us before, short form CDHF, we were originally developed back in 1990 by the Canadian Association of Gastroenterology to become the public-facing arm or the knowledge translation arm of their association. So essentially to take the great research that the gastroenterologists are doing in Canada and to provide it to the public in an easy two-way understand, and to take all the research that they're doing in the digestive health space and provide it to the public in just layman's terms, because research papers can be very hard for people to understand. So our website is us. We do not have a bricks and mortar store that people can come to. All of our information that you do see online is science-based, as it's always reviewed by healthcare professionals, whether that's the GIs that we work with or the pharmacist, registered dietitians, just general practitioners. Everything, videos, infographics, blogs you see has to be reviewed by them. And it is always up to date. It is always unbiased. And our main goal is to help Canadians better manage their digestive conditions or live healthier lives. So just briefly, CAG, which I mentioned is a mouthful, the Canadian Association of Gastroenterology. So the membership is comprised over 1,000 different gastroenterologists, surgeons, pediatricians, basic scientists, and nurses. So oftentimes on our website, you'll see videos and blog posts that often have some of these gastroenterologists that are speaking to a topic to ensure that it is science-based. So if you haven't checked out our website as of yet, we cover 20 different digestive conditions. And they range from things that can affect you from month to month, like constipation or diarrhea, to some things that are more chronic, so lifelong diseases such as inflammatory bowel disease, celiac disease, which you might be aware of, and colon cancer, some food intolerances such as lactose intolerance, pancreatitis, a wide range of different digestive conditions. And we also cover specific diet and nutrition topics because a lot of the times they do go hand in hand. For example, if you have celiac disease, you'll often want to know about the gluten-free diet and just preventative, proactive health strategies for people who are looking to live healthier lives. A lot of hot topics right now in the digestive health space include pre and probiotics, fiber, the mind-gut connection that I'll speak to in a little bit, and many more topics. So there's essentially two sides to our website that you should check out. So I am going to jump into 4 of the most common digestive conditions that we talk a lot about on our website. So first, to just make you aware of them, because a lot of them are invisible illnesses that cannot be seen or noticed, especially in the workplace. And being aware of them can help you as an employer create a supportive and productive work environment. So I'm going to start with irritable bowel syndrome. Now, this is one that is often in the media, and so you may have heard of it already, IBS for short. So it's a disorder that affects the intestine, but the exact cause is actually unknown. As of right now, they are doing a lot of research in this area. But people have been known to develop IBS after food poisoning or traveler's diarrhea, surgery, a change in diet, medication, and different factors such as that. So people with IBS often experience severe abdominal pain, urgencies to go to the bathroom, cramps, bloating, abnormal stool frequency, and all which obviously can be very debilitating on day-to-day life and embarrassing. And Canada actually has one of the highest rates of IBS in the world. So estimated 18% versus 11% globally. So a very big impact in Canada. And doctors, it's often a difficult digestive condition to diagnose, but doctors use something called the Rome criteria that essentially categorizes you into a different subtype of IBS. So depending on if your stool is more with constipation, diarrhea, or you can have IBS with mixed bowel habits. And a lot of the stuff that I'm showing here on screen is available on our website as well. So just a couple of statistics to show you sort of the burden of the people who have it. More than 70% indicate that their symptoms interfere with everyday life, and 46% report missing work or school due to IBS. People with IBS frequently report feeling depressed, embarrassed, and self-conscious. Their ability to predict symptoms places significant burden on their daily living. A patient with IBS misses an average of 13 workdays a year due to symptoms outside of their control. So like those, that abdominal pain, the cramping, the bloating, the mixed bowel habits, having to run to the washroom, those types of things. And the flare-ups, so your symptoms can come and go with IBS. A flare is indicative of when your symptoms are present. And a lot of it with IBS is closely related to food. So it does make it difficult for people with IBS to participate in social or professional activities and events that involve meals. So it's something to keep in mind. It definitely limits productivity and performance at work. It has a negative effect on the quality of relationships and limits participation in routine social activity. And this is all coming from an IBS report that was taken in 2018 from a survey. And it also has a personal financial burden with some individuals, because often it really is an individualized digestive condition where it takes a while to really understand how to help your symptoms. And that could be through different treatment therapies. It could be just from adjusting your diet and lifestyle. So the cost associated with IBS has been significant for many people. And then I just wanted to highlight some of the resources that we have on CDHF.ca that you can use in your workplace. I think it's important to generate awareness, first of all, on these digestive conditions, so people know that what the symptoms are if someone often is missing work, or you can essentially tell the signs of when someone has IBS. So just relaying this information, what it is, what causes it, what are the symptoms that some people may have in the workplace, I think is important. And we have a ton of infographics such as this on our website that would be handy to have in the workplace. So I'm going to move on to inflammatory bowel disease, and it is often, people often mix it up with IBS because of the acronym IBD and IBS, but they are actually very different. So inflammatory bowel disease is at least two separate disorders that cause inflammation, so redness and swelling, and ulcerations, so sores of the small and large intestines. And they are categorized into two disorders called ulcerative colitis and Crohn's disease. So Crohn's disease is a chronic disorder, meaning that it's lifelong, that causes the ulcerations and the sores and inflammation anywhere along the digestive tract. So we often say from gum all the way to the bum as a fun way to remember it. So those with Crohn's may experience periods of active symptoms, like I said, with known as a flare, and other times where symptoms are absent. And the symptoms can include anywhere from severe diarrhea to weight loss, abdominal pain, cramping, diminished appetite, and blood in their stool. And then ulcerative colitis, the main difference is where the inflammation and the ulcerations occur. So in ulcerative colitis, it can occur in the large intestine rather than anywhere in the digestive tract. And it usually begins in the rectal area. People with UC can go up to 20 bowel movements a day and have false urges to go to the bathroom. So you can imagine it being very hard for someone who's sitting at a desk at a workplace. Having to have access to a bathroom is a very important thing for people with IBD. And they can have blood, mucus, and pus in their stools as well, which is very uncomfortable. Again, I just wanted to highlight some of the fun resources that we have that are super shareable for people to understand the main differences between ulcerative colitis and Crohn's disease. So essentially just the location of the inflammation and some of the symptoms that differ between the two. And these are, again, great ways to educate people so that they are aware of the disease in the first place, and they can sort of sympathize with people if they do have some of the symptoms. So how Crohn's may affect someone, the statistics around it, why has it occurred? A lot of it can be from genetics and environment, but that is also an area where there is still some research going into it. And then just positive actions you can take if you do have one of these diseases. Again, some statistics for IBD. So Canada actually has the highest reported prevalence rates of IBD in the world. In 2018, approximately 270,000 Canadians were living with IBD. By 2030, the number of people living with IBD is expected to rise to over 400,000, approximately 1% of the population. And it often affects individuals in adolescence and early adulthood, which is obviously a time where you are pursuing employment or you're building a family and reaching key milestones. So the quality of life, the impact of IBD on quality life is tough. It ranges from just the direct physical impairment due to symptoms like of diarrhea and abdominal pain. People do often lose a lot of weight. The financial burdens, the medication is critical to managing IBD. And then psychological distress. So a lot of people have reported symptom or anxiety or depression from having IBD just because of distorted perception of the body image, social isolation, fear of dependency, and concerns about not reaching their full potential. So moving on to gastroesophageal reflux disease, or GERD for short, easier to say. I mean, a lot of people may have experienced heartburn over time, but GERD, if you don't understand what actually happens, is usually GERD is the result of a disordered valve mechanism between the esophagus and the stomach. So the valve or the lower esophageal sphincter opens normally, regularly opens during swallowing to allow food to enter the stomach, and then closes to prevent food and stomach secretions from moving back up the esophagus. So when the LES actually fails to close correctly, the stomach contents, which are acidic and contains digestive secretions, flows back into the esophagus. And that reverse flow, or the reflux of food, can cause damage to the esophageal lining and resulting in heartburn. So the symptoms, which again are heartburn, regurgitation, chest pain, chronic cough, and belching. In Canada, 5 million Canadians experience heartburn at least once every week. It is a very common disorder that affects 1 in 6 Canadians. And from surveys, people have suffering from GERD symptoms are absent from work 16% of each year, representing 21 billion in costs, or 1.7 billion hours of lost productivity annually. So pretty significant. If you ever had heartburn or acid regurgitation before, it's not fun. So it can definitely affect your day-to-day working at a desk for sure too. And last but not least, celiac disease, which many of you probably have heard of before. Gluten-free or gluten-sensitive has become a pretty hot topic, you could say, in the media, but the two are a bit different in very many ways. So celiac disease is actually a bowel disorder caused by a reaction to gluten. So anything found in wheat, rye, and barley. And if you have celiac disease, eating the gluten actually damages the villi, so the small finger-like structures that make up the lining of your small bowel. And the injury prevents nutrients from being properly absorbed, so you can see from the image there. So it is an autoimmune disorder, but one where the trigger is actually known, meaning it's treatable in the way that you have to avoid gluten at all costs. So it is not a food allergy. You can't just say, oh, I'll have a little bit of gluten today. So even the smallest amount of gluten can seriously damage the lining of your small bowel. And if anyone's ever has celiac disease, they know that the not so pleasant symptoms can include diarrhea, fatigue, weight loss, bloating, gas, nausea and vomiting, constipation, abdominal pain, bone or joint pain, anemia, and depression or anxiety. And oftentimes when you by accidentally eat gluten, they call it being glutened, these symptoms can last for days until you can start sort of feeling better again. So just some statistics as well. Rates of celiac disease have nearly doubled in the last 25 years in Western countries. In Canada, about 110,000 people have been diagnosed with the disease, and it's suspected that an additional 220,000 Canadians are living with the disease, but they haven't been diagnosed yet. It can occur anywhere in any stage in life, including childhood, and it may slightly be more common in women than in men, though the higher rates of diagnosis in women could be due to women getting more regularly scheduled health care and actually going through with the diagnosis. So again, just some of the great resources that CDHF has on our website. I think it's hard if you do not have celiac disease, or even just being recently diagnosed with celiac disease, it's hard to know what is safe, what is not allowed, what foods might be risky. And I think it's always important to have this sort of on hand, maybe in the workplace as well, because if you're doing a luncheon or anything, knowing which foods could be risky for someone with celiac disease, ones that are usually safe or ones that are just absolutely not allowed for them to have. It just avoids anyone by accidentally eating gluten in the workplace. And then I just wanted to touch on the mind-gut connection. This might be an area that you have heard of recently. The brain-gut axis is another way to describe it, but the gut and the brain are very well connected. So obviously you've probably heard you are what you eat, but it can't be more true now that they've put more research into it. Your entire digestive system is actually lined with these mesh-like body of neurons, which is referred to as the enteric nervous system. So our brains are connected to the rest of our bodies through this vagus nerve, and it allows the nerve and the brain to communicate with everything. So our eyes, our vocal cords, our hearts, lungs, and then of course our digestive systems. But scientists have actually discovered that 80 to 90% of the nerve fibers from this enteric nervous system are actually driving against traffic. So they're going from the gut to the brain rather than from the brain to the gut, which is super important because 70% of the serotonin, so like your happy, your key hormone that stabilizes your mood or your feelings, is actually developed inside the gut and sent straight to the brain. So you'll probably have experienced nerves before a big presentation, or your stomach is upset when you're angry, and vice versa, because everything really stems from your digestive health. So nutrition is huge, and it plays a very key role in how you feel every single day. It affects your mood, your well-being, and I think that's important just for people to know how nutrition plays a key role in how productive you are at work, your mood, and all of that stuff. So that really is what I wanted to cover today. We have a ton of resources on our website about how these digestive conditions can impact people in the workplace. A lot of people have come to us and actually asked for toolkits on ways to educate your employer about different digestive conditions. So, and it really starts with understanding of these diseases. If you're made aware of these diseases, you can make people feel more comfortable to come to you. You can understand the symptoms that they go through every single day. So I definitely think that everyone should sort of take some time to educate themselves on the different various digestive conditions and the way that they can be prevented and proactively taken care of. So definitely check out CDHF.ca, and I will open it up to any questions.